How does a full birth go? If your mare has made it through 11 months of pregnancy, you're almost home free. Labor and delivery, while momentous, are generally uncomplicated. Every effort should be made to be present during foaling. In most cases, you will simply need to be a quiet observer. Mares seem to prefer to foal at night in privacy and have some control over their delivery. Hiring a foaling attendant, installing a video monitor, or using a birth alarm system can save the life of the foal if a problem should arise. It is advisable to have your veterinarian's telephone number nearby in case of an emergency. A safe place to foal. What your mare will need, however, is a clean, safe, quiet place to foal. Horses have been giving birth on the open range for eons, and this is still an acceptable choice. Allowing the mare to foal in the pasture even has some advantages. An open grassy area is likely to be cleaner than a stall and provides a healthy environment with adequate room to foal. You won't have to worry about the mare crowding into a corner or foaling too close to a wall. However, many owners prefer to confine the mare to observe her progress. Should you choose to foal your mare in a stall, provide one that is a minimum of 14 feet by 14 feet. If possible, the stall should have adequate bedding and a floor that can be readily cleaned and disinfected. Dirt or clay floors make sanitation more difficult. Straw, particularly wheat straw, is preferable to shavings, as it won't cling to the wet newborn or mare the way small wood particles can. Remove manure and soiled bedding promptly and disinfect the stall between deliveries. The countdown. Mares provide clues that they will soon give birth. However, the timetable is far from absolute. Some mares may show all the signs like clockwork, while others show practically none. The following is a general guideline, but be prepared for surprises. The mare's udder begins filling with milk 2 to 4 weeks before foaling. The muscles of the vulva and croup relax. The trailhead may become more prominent a few days before foaling. The teats become engorged 4 to 6 days before foaling. Waxing of the teats occurs, a yellowish, honey-like secretion appears 1 to 4 days before foaling. The mare becomes anxious and restless. She may appear to be colicky. She may kick at her belly, pace, lie down, and get up, look or bite at her flanks and sweat. She may frequently raise her tail and urinate. Generally, this is the first stage of labor. However, be aware that colic remains a possibility. If such behavior is prolonged for more than an hour or two without progress towards foaling, contact your veterinarian. Preparing for birth. Most mares foal without difficulty. It usually is best to allow the mare to foal undisturbed and unassisted. If a problem becomes apparent, contact your veterinarian immediately. What you can do: write down your veterinarian's phone number well in advance of the birth and keep it on all phones. Keep a watch or clock on hand so you can time each stage of labor. When you're worried or anxious, your perception of time becomes distorted. The watch will help you keep accurate track of the mare's progress during labor. Take written notes so that you won't have to rely on memory alone. Wrap the mare's tail with a clean wrap when you observe the first stage of labor. Be sure that the wrap is not applied too tightly or left on too long, as it can cut off circulation and permanently damage the tail. Wash the mare's udder, vulva, and hindquarters with mild soap and rinse thoroughly. Clean and disinfect the stall as thoroughly as possible. Provide adequate bedding. Test strips that measure calcium in mammary secretions are available commercially. These strips aid the owner in predicting when the mare will foal because sudden increases in calcium are associated with imminent foaling. Understanding labor and delivery. Labor is divided into 3 stages. Stage 1 begins with the onset of contractions and generally lasts 1 to 2 hours. Even in a normal delivery, the mare may stand up, lie down and roll several times to properly position the foal for delivery. During this phase, contractions move the foal through the cervix and into position in the birth canal. The fetal membranes, allantois, may become visible at the mare's vulva. When the sac breaks, signaled by a rush of fluid, stage 1 ends. The rupture of the allantoic membrane and rush of placental fluids may be confused with urination. Stage 2 is the actual expulsion of the foal. This phase moves relatively quickly. If it takes more than 30 minutes for the mare to deliver, there is most likely a problem. If there is no significant progress within 10 to 15 minutes after the membrane's rupture, call your veterinarian immediately. If labor seems to be progressing, wait and watch. Normal presentation of the foal resembles a diving position, with front feet first, one slightly ahead of the other, hooves down, followed closely by the nose, head, neck, shoulders, and hindquarters. If you notice hoof soles up, the foal may be backward or upside down, and you should call your veterinarian immediately. If you suspect any deviation from the normal delivery position, call your equine practitioner. The most deadly of foaling emergencies is a premature rupture of the chorioallantois, known as red bag delivery. If at any time during stage 2, you see red/maroon membranes covering the foal as it emerges from the vagina, the placenta must be rapidly torn open. The foal is detached from its blood and oxygen supply. Normal membranes that cover the foal are white or yellow and translucent. Stage 3 labor begins after delivery and is the phase during which the afterbirth placenta is expelled. Most placentas are passed within 1 to 3 hours after the foal is delivered. If the placenta has not passed within 3 hours, call your veterinarian. A retained placenta can cause serious problems, including massive infection and laminitis. Postpartum care for mare and foal. In the excitement of birth, it is important to remember some tried and true guidelines. Allow the foal time to break the fetal membranes, see red bag delivery exception above. Once the foal breaks through, be sure it is breathing. Generally, it is not recommended to cut or break the umbilical cord. If it has not broken during delivery, it will usually break when the mare or foal gets up. The cord should break at a site approximately 1 inch from the foal's abdomen, where the cord's diameter is slightly narrower than the remainder of the cord. If it is necessary to manually separate the cord, it should be held firmly on either side of the intended break site, then twisted and pulled to separate. Never cut the cord. Twisting and pulling of the cord stimulate the closure of the umbilical vessels and reduce the likelihood of hemorrhage from the cord stump. If bleeding persists following cord separation, pressure can be applied to the stump for several minutes by squeezing with a thumb and finger. It is not advisable to suture or permanently clamp an umbilical stump. Foals will not typically lose enough blood to become anemic, and there is a significant danger of trapping pathogens in the umbilical stump when you suture it closed. Encourage the mare and foal to rest as long as possible. Allow them to bond undisturbed. Treat the umbilical cord with an antiseptic solution, recommended by your veterinarian, soon after the cord breaks and for several days thereafter to prevent bacterial infection. Diluted 1,4-chlorhexidine solutions are preferred over strong iodine for navel dipping. Tincture of iodine can burn the skin surrounding the umbilical stump and should be avoided. Observe the mare and foal closely for the next 24 hours. Importance of colostrum. The foal must receive an adequate supply of colostrum. Colostrum, the mare's first milk, is extremely rich in antibodies. It provides the foal with passive immunity to help prevent disease until its immune system kicks in. A foal must receive colostrum within the first 8 to 12 hours of life to absorb the antibodies. If a foal is too weak to nurse, it may be necessary to milk the mare and give the colostrum to the foal via a stomach tube. A final note. Nature has provided an efficient system for the mare to deliver and care for her young. Be a prepared and informed owner so you can enjoy the miracle of birth. Keep your anxiety in check and help the new mother and foal get off to a great start. So this is the end of our today's video. Do you like it? Share your precious thoughts with us in comments section below and subscribe to our YouTube channel.